70% of your immune system takes place in the gut. 70%, that's huge. I don't think people understand the role your immune system plays in implantation and pregnancies. The amount of times I test the gut health and I see inflammation come back, usually that is through the marker of calprotectin. It's just astronomical. If your system is inflamed in any way, and if it's on a larger scale, specifically something with the gut that's just so integral in so many different places of our system, that is going to be definitely impacting fertility. I love to emphasize fiber. People talk about even 20 grams. I used to say that. Now I'm more on the side of like 30 to 40 grams.
As Americans' health declines, so as sperm counts are declining, as hormone levels are declining and changing, you're saying that the quote unquote normal ranges are changing to reflect effectively an unhealthy culture.
Yeah.
Wow, that's very alarming. Hey everybody, I'm so excited for today's episode of the Gut Check podcast. We have an incredible guest, Dr. Samantha Ess, who's the founder of Walk the Natural Path on the show. We are going to dive into gut health and how it impacts things like fertility, talking about natural methods of fertility, and really getting into how the environment impacts our health. Also, we talk a lot about men's health and declining sperm counts and men's fertility as well. So you're not going to want to miss this one. It's an awesome episode. Please let us know what you think. Leave a comment, like, share the episode, and we'll see you soon. Hey everybody, thank you for joining us for another awesome episode of our Gut Check podcast. I'm so excited about our conversation today. We have Dr. Samantha Ess with us. She is the founder of Walk the Natural Path, focused on hormone health and fertility care. There's a ton we're going to dive into today. Dr. Samantha, thank you for joining us.
Thanks for having me. I'm really excited to be here.
Yeah, well, we are excited to have you and love the approach that you've taken specifically to gut health, which we'll get into. That's what caught my attention first and foremost. But why don't we just start by having you walk through your background and what led you to start this beautiful practice that you're running today?
Yes, I always say I'm going to try to keep this short and sweet. So let's see if I've mastered it yet. Long story short, natural medicine was a big part of my life growing up. I was kind of sick as a kid. My mom was my champion and actually found natural medicine. Again, very long story short, I went from being on, oxygen treatments 2 times a day to no longer needing that or any medications. And it basically just changed my life. So I really like to share and emphasize the fact that it was definitely my story that brought me into natural medicine. And then what I learned and experienced throughout medical school, which led me to naturopathic medicine and, building the practice that I now have as Walk the Natural Path.
So for someone who doesn't know or is new to kind of natural medicine, what's the biggest difference between naturopathic medicine and traditional medicine?
Yeah, that's a great question. So both, I like to state for the record, I think are very needed and very wonderful and essential in today's world. Traditional medicine is more like the typical, you see a doctor, you get a medication, or you just go, once a year for your check-in, things like that. Natural medicine's a little bit more, I don't want to say well-rounded, because like I said, I think we need both, but we do focus on things like diet and lifestyle and herbs and supplements, and we learn to treat the whole system. And there's just a lot that we focus on that tends to be a little bit different from not only just what we do as practitioners, but even our training, right? Our training was very much, let's focus on treating the root cause, which I know we'll talk about a little bit more in a little bit. And how do we do that? Because I feel like a lot of people think like, oh, it's so easy, just treat the root cause, but it's actually very much a skill that you have to hone and kind of perfect. And within our schooling, we not only take diet and nutrition, which most practitioners do not have to take. We also take herbal medicine, botanical medicine, physical medicine, psychology, and we learn basically the foundation of naturopathic medicine. We call it the therapeutic order. And I think it's really beautiful, but it's a pyramid, kind of like you would see like the food pyramid, right? And on the bottom is going to be, the basics, right? Diet and lifestyle as treatment. The next piece is going to be herbs and supplements. The next piece is going to be medications. And then the last piece will be surgery, or more invasive treatments, right? So it's pretty cool when you start to look at it like that. And there's definitely a way to kind of train your brain to actually learn how to best do that.
So, what exactly is naturopathic fertility care?
Yeah. So I've kind of taken naturopathic medicine and just from learning and mentorship that I've been through, created what I like to do for those struggling with fertility. So it's still very much diet and lifestyle, herbs and supplements and all of that great stuff. It's just a little bit more focused on fertility care. I look at numbers slightly differently. I am going to be looking at things that, might not impact overall health in general, but really do impact fertility, because fertility is one of those pieces where you can actually feel really okay, but your body is still struggling to conceive. And that can be really difficult to find what's going on underneath everything. If you're just like, I feel healthy, I live a healthy life, what's next? So I would actually say majority of my cases are people who feel pretty good, who just haven't been able to figure out the underlying cause of what's going on for fertility.
So, when it comes to naturopathic fertility care, what unique benefits does it have for those trying to conceive versus if they were to just go in more of the conventional path?
Yeah, so I find that a lot of people go the conventional path and are either told, this is unexplained, which I kind of already touched on, right? This is unexplained fertility. Let's go to IUI or IVF, which to me makes little to no sense, because most of the time, if you find an explanation for fertility, at least in the conventional world, it's something that IUI or IVF can absolutely fix, right? Like or not absolutely fix, but definitely work in their favor, in the sense of, if we're not ovulating, IUI via letrozole, right, via medication could help ovulation occur. And then we get the sperm past the cervix, and that creates more opportunities, obviously, to conceive. If there is a lower sperm count, but not too low, again, with IUI, we're passing barriers to get sperm to meet egg. But if people are told that they're ovulating and the sperm count's okay, why do we need to do those things or even jump to IVF, right? Why is that something we have to do? And most people get
Yeah.
told it's your only option, essentially because they don't know what other options are. Not them being the patients, but the practitioners. And I don't ever like to hate on other practitioners, but it's just kind of the reality of it, of they just not sure what the next step is. And the only step they know of to be impactful for them or for their patients is going to be IUI or IVF.
Yeah.
There are other cases too. I mean, I totally believe people can also get pregnant naturally if they aren't ovulating, or if there is a low sperm count, we can improve those things as well, right? I just feel like a lot of times no one's given the chance. And a lot of that has to do with the basics of what we're probably going to dive into more, but the diet, the lifestyle, herbs, supplements, hormones, gut health is very important to me. And so, there's kind of a lot of nuances with that, but again, I try to keep it as short and sweet as possible.
How do you specifically in your practice, how do you assess the patient method for root causes, and how are you looking at what's the best way to start with some sort of root cause assessment?
Yeah. So at first, I like just time with the patient to get to know them, to get to know their case, right? So my first visits with a patient or client, I sometimes see just one of the partners, and then I see sometimes both people together. But the visits are going to be either 60 minutes or 100 minutes. And we use all that time usually. It's very rare when I don't. And there I just get to know not only their fertility case, but I get to know them as individuals, how their diet and lifestyle is. I learn their symptoms if they have any. We learn about their medical history, their family history. So diving in and getting to know them is really important, right? Like I feel like most practitioners spend max 20 minutes with a patient, right? And so, if we go from 60 or 100 minutes, that's a lot of time. You can really get to know someone and kind of see what's going on. So that's really helpful, especially when I'm assessing what labs to order, right? So diving into the root cause, I do it very much based off of what they're telling me they're going through. But I also do really love labs, and I do like to rely on them in the sense of I love doing hormonal labs, right? So for women, that's going to be day 3 labs, 7 days after ovulation labs, and then other little labs in between, right? From anything from a CBC to also checking their ferritin, their insulin, thyroid antibodies. The list can go on and on. I do have basic ones that I really do like to draw. And then I, again, base that off of what they're also telling me, right? Do they have a genetic maybe link from what I think their parents have gone through, et cetera, et cetera. And then again, bringing it back to gut health, I'm actually a big advocate of testing the gut instantly, whether or not they actually have specific, oh my gosh, like issues with their gut health, right? So meaning like bloating, gas, constipation, diarrhea. They don't have to have those for me to be signaling we need to treat the gut. They can get sick often. They can have brittle hair and nails. They can, have low fatigue or brain fog. And honestly, even if they don't have any of those and they feel great, I'm still testing gut, and we can go through the reasons why. But I've just seen in my practice clinically how that can be one of the biggest game changers, if not the biggest game changer when it comes to fertility health and even balancing hormones.
So we do want to dive into the gut, and you are a champion of gut health and of how it connects to hormone health, fertility. So thank you for that. And thank you for all the wonderful education that you've been sharing. We talked about symptoms, but how does gut health specifically influence fertility and then overall hormone health?
So loaded question, right? Very loaded, but I'll keep it, again, I'm repeating myself, as simplistic as possible, because I feel like we could spend a whole hour talking about this one piece alone. Gut health impacts it. I kind of think of it in categories, right? So the first one being inflammation, right? So a lot of people have underlying inflammation, specifically with the gut. Like the amount of times I test the gut health and I see inflammation come back, usually that is through the marker of calprotectin. It's just astronomical. So one is inflammation. I kind of tell people, I'm like, if your system is inflamed in any way, whether it's your gut or, you injured yourself and your wrist is inflamed, like your body is reacting to something. And if it's on a larger scale, specifically something with the gut that's just so integral in so many different places of our system, that is going to be definitely impacting fertility, right? Because from anywhere from just having a good healthy gut, because then the inflammation in the gut's going to lead into microbiome imbalance, which can lead to susceptibility to infection. And again, like the cascading effects are very, very big. They're it can continue, they all just can kind of circle into each other, so it can get kind of confusing. But I also think of implantation, right? If you are inflamed, your body's not going to implant an embryo into your uterus and then grow this living being, right? Because your body's like, I'm too busy dealing with this inflammation that I got going on. I don't have time to also figure out and downgrade the immune system and make sure that this new life is healthy, right? Which kind of leads into my next piece, which is going to be your immune system. 70% of your immune system takes place in the gut, right? If people listening to your podcast, they probably know a lot of these things already, but 70%, that's huge. I don't think people understand the role your immune system plays in implantation and pregnancy. So really short version, your embryo that's created is part you, part your partner. That is foreign tissue. And your body is trained to attack foreign tissue. So if your immune system isn't on the right track, or it's not optimal, right, it is going to say, we don't want this foreign object, we don't want this foreign tissue. Again, no implantation to occur. Another one is just if your gut isn't optimal and in layman's terms, there's a term called leaky gut, right? Which essentially is when the tight junctions are not as tight as they used to be. I kind of just say that you're not going to be absorbing not only nutrients properly, but also we're letting toxins in the system. And that's also going to be an issue because a lot of absorption in the gut of macronutrients, are crucial when we're talking about building blocks of hormones, right?
What's great about what you just said and all of that is that all of those things can be fixed, and that's really encouraging. And so there are some problems that are harder to fix, obviously, but a lot of these issues can be solved. And so I want to encourage our audience, and we could dive into that in a moment. Would love to kind of have you share kind of on a macro level what you're seeing with infertility statistics right now, how many couples are dealing with infertility, and then also, how many women you're seeing with kind of hormone imbalances.
A lot of people ask me this question, and they also ask me my thoughts on like why the rates seem to be declining so rapidly. And I think, one of the key answers is it's being talked about more. And so I think we're actually knowing who's actually struggling trying to conceive versus it being as like a taboo topic that no one talks about. So one, I do think that that's a piece to it. I think it had been declining. It's just maybe showing a more rapid because we hadn't had the numbers hold necessarily properly before because people didn't want to say like, yeah, we're struggling or even know that they're struggling, right? Some people are like, yeah, I've been having unprotected sex for 7 years, but we haven't actually been trying. But in the medical world, that would actually count as trying. Maybe not, you're not planning based off ovulation every single time, but if you're not keeping track or providing any sort of protection, that technically is trying, right? So one, I think it's a little bit about that. Two, I do think it has to do with the environment that we're in, right? I think it's our food, our water, our stress, our, mental load that we're carrying and emotional load. I feel like not necessarily that it's increased, but I think with everything in today's world, we have more time to sit and think about things, which can be good and bad in multiple ways, which again is also kind of a longer conversation. I feel like I keep repeating myself, but when I say that, I'm just wanting to make sure that, you're not just taking what I'm saying and just like rolling with it, that there's also more exploration in what I'm saying, because I think that's all very important.
Getting more granular, what lifestyle changes do you recommend first and foremost for your patients who are dealing with gut health related fertility issues?
So first off, a lot of people don't understand that like the basic diet and lifestyle stuff, yeah, it's good for reducing your stress and yeah, it's good for your hormones. It's also really good for your gut. Like good sleep is very essential for good gut health. So it's just following that movement, right? Does anyone ever talk about like, so if you're a little constipated, if you start exercising or you go for a walk, all of a sudden you're going to poop? Like that is actually really beneficial. Movement is very helpful for gut. Obviously diet is going to be big, right? People talk about, I know like probiotics and prebiotics, and those are really good. I love to emphasize fiber. People talk about even 20 grams. I used to say that. Now I'm more on the side of like 30 to 40 grams. The more I love fiber now, I'm all about the fiber, especially for gut health. The biggest key there though, is if you're only having like 10 grams of fiber a day, slowly increase the amount that you're having a day, because that could get really uncomfortable really quickly. And then water intake, obviously going to be important. Working on stress and reducing stress is going to be important, right? I mean, people talk about your parasympathetic nerve and how that is very important. Rest and digest, right? Your vagus nerve. We want to activate that. And if that's not activated and we're in constant fight or flight, we're not going to rest and digest properly, right? And that's going to be essential. So, I mean, those are just a few things, but very impactful.
So what are some of the red flags that would kind of separate someone from needing more intense treatment versus just needing lifestyle changes?
Well, I'll be the first to say, like, with my fertility patients, I'm pretty much always giving them additional recommendations besides lifestyle changes, just because my population, they've usually waited already a long time. They've done a lot of effort. They've been doing the diet and lifestyle things consistently for 6 months to a year. Like, I have a very unique population. So I'm always doing added things. I personally think if you want to heal a little bit faster, it's nice to have those added things, right? Just some gentle herbs and supplements. I always think we should be treating candida, especially with herbs and supplements. I think there are some docs out there that will be like, just, stop eating sugar. There's been so much research done that have actually shown that candida actually can figure out how to survive without sugar. So you're technically not going to starve it. You might make it a little bit weaker, but the moment you add certain things back into your diet, it's going to flourish again. So getting rid of candida, I think, is going to be one of those things where we need, herbs, antimicrobials, immunoglobulins, prebiotics, probiotics. But basically, we want things that nourish the gut lining, right?
Yep.
DGL powder, curcumin, glutamine. Again, these are things to not just start doing right now. These are things to talk to a practitioner about and very, very much figure out what you need based on your results. But I'm always going to be someone who says, get a gut test and let's treat with herbs and supplements. So H. pylori is also one of those that I believe should also have treatment. I do think that a lot of people point to parasites, which I might have a different opinion than a lot of people on parasites. So I used to be one of those that saw a parasite and was like, we need to get rid of that immediately. My perception has switched a little bit to what else is going on in the gut. Let's treat that first. Let's make sure we have an optimal environment. And then let's see if we have symptoms that are still, present, such as like the brain fog, joint pain, excessive weight gain, etc. Those are obviously just a few of many symptoms that can go along with parasites as well. But I am not a big fan of let's do parasite cleanse anymore. I rarely give them. If I don't think I've given one a very long time. And I am a huge advocate of let's heal the base of the gut. And that should take care of those extra pieces that seem to be abnormal.
What are some of the top indicators for parasite issues? I mean, these become kind of a fad. So would love to hear you just talk about this a little bit more.
Yeah, I mean, and a lot of the supplements, a lot of the symptoms for parasites can also be very hand in hand with like candida or even H. pylori, right? Like a lot of people can feel inflamed or bloated or have joint pain. H. pylori is going to be a little bit more like heartburn, acne, a little bit more emphasis on the bloating, but candida can also go hand in hand with H. pylori. So there's also like stacking of gut health issues, which tends to happen a lot, specifically if you've had an imbalance in your microbiome for an extended period of time, right? Like seeing H. pylori with candida is very common. But with the parasite, I find that they can mimic a lot of like symptoms, specifically of candida. With some of that brain fog piece tends to be really big in parasites. Fatigue, which these are symptoms that, to be honest, there can be a lot of causes for them, right? So that's why I'm always kind of like, let's fix like general gut health. And then if we still have these symptoms, then we can treat the parasite, or then we can do the parasite cleanse if needed. But most of the time, once our body's in a right position, I feel like they take care of them themselves. The hard part about parasites, though, is even if you test negative for them, you still might have them. And I'm sure that's been shared a lot in the sense of they're tricky and they might not be in a certain part of their cycle while you're testing for them. So you might not actually have them or test positive for them in your stool. So there's a lot of nuance to parasites, and I feel like a lot of symptoms that parasites present can also be either explained away from something else that's going on in your system, or could just mimic like something else that's going on.
Why are we seeing so much more parasite activity in people's bodies?
Yeah. So one, I think again, kind of like with education, like people didn't really know or realize parasites were a thing. So now all of a sudden they're taking these cleanses and they're pooping out all these worms. One, half the time they're not real worms. I don't know if you look at pictures, but I'm like, that's not a worm.
Yeah.
That's like that you're cleansing, but that's not a worm.
Yeah.
Two, yeah, right. Like sometimes I'm like, what?
Yeah.
Um, Two, I think that people are doing them and feeling better. Like, absolutely. But if you look at parasite cleanses, they have binders, they have a lot of times
Mm-hmm.
pre or probiotics involved. They have other things that I'm like, maybe that's the thing that's making you feel better, not necessarily the parasite leaving, which the parasite leaving could also make you feel better. But I'm just saying that a lot of the cleanses also have just general gut health pieces in them. And some people have to do parasite cleanses a million times, but I'm like, is that because you have leftover parasites, or is that because 2 weeks is not enough to fully heal the gut if you're doing a cleanse? Um, so I definitely have a lot of thoughts on that. And again, I'm not trying to hate on all parasite cleanses or anything like that, but I do think we also like to reach for a quick fix, and blaming a parasite and doing a 2 week parasite cleanse is a lot quicker than addressing the fundamentals of diet and lifestyle.
You talk about advanced testing that you use in some of your deep dive assessments. Can you walk us through the types of testing that you're using?
Yeah, so I really like the GI map. I know some practitioners are a big hater on the GI map. I have found no issues with it. And I have really, every time I treat based off it, I feel like I get really good results, or at least someone's improving, and then we have to treat again. But again, the gut health, we don't know how long it hasn't been in an optimal state. So it might take one or two treatments to actually heal it. But I like the GI map by Diagnostic Solutions. That's a PCR DNA test. Long story short, it's just really sensitive compared to most. So H. pylori breath test that you do with your, doctor, a lot of times I see those come back negative, and then people test positive for the stool H. pylori test. And that's a big deal when it comes to fertility because of what I talked about and how H. pylori can get in the cervical mucus, right? Like we need to double check and make sure that is dealt with. So that's the test that I really like. I eventually can do other tests like organic acid tests and things like that, but I don't necessarily lean into those until I feel like I have to. There is also the SIBO breath test. There are a few ways about that to do that test, excuse me, or not a few ways, a few different types of tests. Like there are a few types of SIBO, and I feel like a lot of people don't talk about it, right? There isn't just one SIBO. There's hydrogen, there's methane, and there's sulfate. And there is a Trio Smart test. I think it's called Trio Smart. That one I used to use a lot because I wanted to make sure I wasn't missing the sulfate. But then I was getting a lot of like false negatives, and because I was like, I don't believe that, so I would have them test and the other test, and they would come back positive. And once we treated their SIBO, they did get a lot better. So I'm a little bit more testing just the hydrogen and methane again. And then when I treat based off that, I see really good results. Again, SIBO is one of those that can be really tricky to treat. So I always say expect 2 to 3 times of treatment. If we only have to do one, great. But I like to have people's expectations set up for that.
So many women are just making the connection between how their gut and their hormones are connected, not yet. I think this is kind of on the forefront of how the gut is connected to fertility. So it's just wonderful. Switching gears a bit, what's your view on fasting for fixing gut issues?
That is a great question. I'm actually probably one of the few people that doesn't love fasting. Maybe that's because myself, I haven't done it or loved it. And when I say not a huge fan, I should correct myself in the sense of I do like safe and effective forms of intermittent fasting, but I feel like your question was long-term fasting. Is that correct?
Yeah, there's very different opinion, but also different science. There's some good science that 72 hours plus can really help with healing the gut. But I'm curious on your opinion, and then I'll share mine. But it's good to get different opinions on this.
Oh, I agree. And I think it's always important to be challenged because that's how you grow, right? But I believe that I actually think fasting can be very beneficial, but like I said, it has to be very strategic. So one, with a 72-hour fast, I do believe that can actually reset the gut. But what I also believe is most people do it very incorrectly and
Yeah.
unsafe. right? Because people
Yeah.
are fasting and then they're going about their full work day. Absolutely
Yeah.
not, in my opinion, right? Like we need to be on the couch doing nothing. But if you're trying to do like a full day and work out and do all this other stuff, that is not safe. So I think I usually just go about saying like, we're going to do it this other way because most people are not doing it to the T of what I think you need to do. Intermittent fasting, though, and little small versions of fasting, I actually do love. So, intermittent fasting in the sense of you're eating enough calories throughout the day, but then you have only a certain hour, a window eating hour, right? And you stop eating
Yeah.
around 7 p.m., maybe even 6 if you can, and then you wait to eat for 14 hours, and then you have your breakfast in the morning. So I do like that. I think that can be really good for gut health. And then also just something simple as like making sure your meals are 2.5 to 3 hours apart can be really beneficial and help the turnover of your gut motility cells, right? So
Mhm.
that was a lot of words of saying like it depends.
Yeah. Yeah, no, I think and to summarize it, my feedback that I would add to this would just be that it's very different for men versus women, very different.
Oh, I love that. Yep.
And for women, if you're having hormone issues, maybe low progesterone issues or different issues within your progesterone and estrogen levels, fasting sometimes is the worst thing you can do when in fact you should be waking up and having protein. We are really overlooking this key part of the puzzle, which is the male and male fertility. So, what are you seeing when it comes to males playing a role in the infertility struggles currently?
Well, first off, I'm so happy you mentioned men versus women in fasting. That is something I emphasize so much to my patients, right? Like they'll be like, my husband skips breakfast. I'm like, well, we want to make sure he's eating enough throughout the day, but that's not as big of a deal as it is for you. So like, just
Yeah.
because he's doing it doesn't mean you can do it. So I love that you emphasize that. Two, when it comes to male fertility, I love that I've incorporated that in this talk because I am a huge advocate of focusing on male fertility. Not only does it matter for their sperm values, right? So concentration, motility, morphology. What I basically just said was how much sperm, what the shape is, and what the size is. Those things are going to matter, and those are found on a semen analysis, which aren't done as much as they should be. It's like one of the easiest tests to do. I know for some men, if they have to go into the office, it can feel uncomfortable, but there are even at-home kits now that are pretty accurate that you can also do. So I'm like, just test that because it's just a good check to make sure you're having okay values. The other side of that, though, is a lot of the normal values aren't necessarily optimal. So
Mhm.
normal with hormones, honestly, I feel like with gut health and with
Yeah.
semen analysis does not always make it optimal. So our values of what is normal shifts based off what the average person's values are, right? So
Mm.
we're seeing a decline in fertility, and now we're
Yeah.
are basing our values off of basically what the average is right now. Like that's not ideal. So I like to use like old average values that when
Yeah.
fertility rates were a little bit higher. And so I'm using different values when I'm evaluating that. I do actually have a semen analysis. It's like a freebie that's in my Instagram link in bio. I know we'll talk about that later, but just
Yeah.
if you are like, how am I supposed to tell if this is optimal? I have that there. Um, the biggest thing I've seen drop actually exponentially is morphology. Morphology, like I used to even say above 14%. I don't think I've seen a morphology above 10% within the last year. So it
Wow.
is dropping, and I have seen it drop like actually, but now I will say we would love to get it above 10, but that is very profound, right? That's something that I've seen in like real time happen, which is wild. But I do believe that has to do with the environment, environmental toxins, um, and especially men who work like more blue collar jobs or they're exposed to constant environmental toxins and they don't take any of the precautions, we're also seeing that very much so. But same with men who are constantly stressed, right? Like I guess it's just give and take in what they're exposed to.
As Americans' health declines, so
Mm-hmm.
as sperm counts are declining, as hormone levels are declining and changing for the worse as our health gets worse, you're saying that the quote unquote normal ranges are changing to reflect effectively an unhealthy culture.
Yeah. Yeah. So they take it what's based off like a bell curve, right? So what are the
Right.
averages right now? But yeah, I'm like, but we're not very healthy right now. So we
Wow.
have to,
That's
yeah.
very alarming. That's like when you get to the point where 74% of Americans are obese or overweight and you're saying that's the new normal.
Mm-hmm.
Wow,
Mm-hmm.
that's yeah, okay, that's very very concerning. What are some symptoms that men might be having that could indicate fertility issues?
Men are very interesting in the fertility space because one, this is not to, I'm not trying to like hate on men or anything. I think men are awesome, but they are tend to be not as in tune as women are with their body. So I will be honest, like most men are like, I'm fine. Everything's fine. I feel great.
Yeah.
So I have to like really dig to find like anything half the time. And most of the time they're still like, I feel fine. Like biggest thing they'll
Yeah.
admit to is like being stressed, if that. So men are going to be very different in how I operate with them. One, I do everything very much based off their labs. I will say some of them will tell me they're tired or maybe their libido wasn't as high as they used to be. Testosterone is a lot lower across the board for most men as well. That's another value that's crazy. Like they'll be like, if you're in the 200s, that's low, but you're technically normal. And I'm like, I want you to be at least above 600, right? So that's just kind of crazy because that is such a difference. Which actually that I think has been
Why
a
are
value.
testosterone levels dropping so rapidly in men?
Yeah, well, I think that has to do a lot with the environment, right? So if we just want to take something very simplistic, right? Plastics, for example, they impact an enzyme called aromatase. Aromatase essentially converts testosterone to estrogen. Testosterone goes to estrogen, and if aromatase is kicked up, which it is when you're using plastic to say drink out of a water bottle, right? Or the Keurig cups, those are a big one, right? You're using those, that's going to uptick your aromatase and that's going to flush your testosterone to estrogen. So a lot of times I'll see a little bit higher estrogen and lower testosterone. There's the other flip side of if the testicles are not producing enough testosterone, meaning they're not getting the right signals from the brain or their body's telling them that they don't need any more. For example, a lot of people are taking TRT. We'll eventually see if they stop that and say, try to conceive all of a sudden, we'll see a drop in testosterone. And a lot of men are now going on TRT for extended period of time because they're not told that it impacts their fertility chances later on. They're like not even had that conversation, which baffles me because that can I've helped a lot of people turn it around, but that can permanently impact you.
What is TRT? What is TRT for someone who might not know?
Yes, thank you for clarifying. Testosterone replacement therapy.
So this is the equivalent in a certain way to like hormone replacement therapy that our women are going through is testosterone replacement therapy.
Yep. Yeah, and actually, a lot of women are actually put on TRT now, specifically those
Mm-hmm.
that are aging, going through perimenopause. They'll be like, you're low, you need TRT. I am like not a fan of TRT. I could actually even get my license to prescribe it, but I just won't because I won't ever give it.
And the warning it sounds like you have for men is that if they are men that are trying to have children, TRT can directly impact their fertility chances.
Absolutely. It can lower your sperm for an extended period of time, or for some people, even permanently. It's big.
Wow.
Yeah. It's actually something that like really upsets me when they're sitting there and they're like, no one told me. No one told me that that
Yeah.
was something that could happen. They just told me I'm going to feel better.
Yeah. Well, it's similar to the overuse and overprescription of something like birth control that
Yeah.
we put women on for decades and decades and then, don't talk to them about any of the, potential implications that could have. I want to go
Yeah.
back to the testing thing. It's kind of bugging me in a way. Why are we culturally accepting low readings now as normal?
Well, one, I think doctors are like, well, this is the average now. This is what I see all the time. So you're fine. Like, I really think that's part of it. And no one wants to hear that something's wrong with them, right? So unless they've been usually struggling for a while or they're looking for other answers, they're going to just accept that, right? On top of it, like, just to clarify, when they're changing the results, like I was talking specifically about semen analysis, they do it for some other values as well. But most other values have, or ranges have, been the same for a very long time. I just wanted to clarify that it's definitely something they do, but the big thing I've seen it with was the semen analysis of the last few years.
How can a man who cares deeply about this and wants to have children, how can he support his own fertility?
So honestly, a lot of the basic diet and lifestyles that we talked about earlier, right? Just like getting good sleep, movement, eliminating environmental toxins, which I know can get really overwhelming. I usually say, like, just start with a few things like filtered water and trying to remove as much plastic out of your life as you can. I understand that that's not going to completely happen, like plastics everywhere, right? But just do as much as you can, especially for what you can ingest. And then for men, they have to be a little bit more careful in like saunas, right? Or if they go biking or they really wear tight shorts. I just say really be careful and cautious of that. Those are, I would say, basic things, but a lot of it also will depend, obviously, what comes back as in their labs with all the other stuff that goes beyond diet and lifestyle.
What are, if you were to boil it down, the three most important environmental changes that a couple could make for fertility?
Filtering water is my number one, literally.
Hmm.
I guess this isn't like, it's kind of multiple things, but number two would probably be replacing everyday things, right? So, but you don't have to like throw everything away at once and then replace it. I tell people, I'm like, once you run out of something, just replace it with something that's clean. It's really easy. That's really quick to do. And then honestly, I think the third thing, I'm just thinking offhand, would to be eat at home and make home cooked meals with good quality ingredients.
Kind of as we start to wrap up here, would love to hear, if you were to give advice to other practitioners, what would you tell other healthcare practitioners looking to integrate gut and hormone awareness into fertility care?
One, I would say, I mean, definitely just continue to educate yourself through platforms and mentors that you feel like you can trust and listen to. I personally, to get my fertility training, I studied under Dr. Jacqueline. She's actually now the chief medical officer of Dutch, and I learned so much from her. And she did fertility for 15 plus years, maybe even 20 plus before I even took the mentorship. So I learned a lot from her and just her clinical experience and knowledge. And then also, I have no affiliate codes or anything with this, no plugin, but I learned a lot on gut health. I mean, obviously from my school training, I took even extra gut health shifts. Like, I've always been really fascinated with gut health, but I've also learned a lot. Her name's Jade, I think, Etter, and she does like the Microbiome University for practitioners. I highly recommend that platform. I feel like I've learned a lot from her. And she even has like an ongoing platform where, I mean, I'm even still monthly involved in it because she just updates things and she does a lot of like the research side for you. And I really trust her research skills and saves me a lot of time. So I would, like I said, I don't have any affiliate, but I absolutely would recommend her programs for practitioners.
You are seeing patients and couples every day. They're having a hard time. And so, what do you tell them practically to just encourage them if there's a couple that's been, trying everything, so to speak, and still having a hard time with fertility?
Yeah, I just want to say that you are not alone, and there are people out there that will support you and care for you. And if you haven't found them yet, even if I know it might sometimes feel discouraging, just know we're here and we're here for you. I also like people to know that they're doing the best they can and nothing's their fault. I feel like a lot of people on the infertility journey take a lot of the burden, especially if a test comes back and like it shows that something's wrong on their end, but their partner seems to be fine. That can feel heavy. And I just want to say, like, even if that is the case, it's still not your fault. You did not know anything going into this. We're all actually still just learning, experts included. And I just think having grace with yourself is going to probably be one of the most important things on this journey.
Are there any common fertility myths or just misconceptions that you'd like to debunk?
Oh my goodness, I feel like there's so many. I'm like, okay, what's the first one that comes to my mind? I think the big one would be that you can't improve egg quality. That's like the first one that comes to my mind. And a lot of people talk about it and they're like, you can't do it. Your eggs are you're born with your eggs and they're impacted from the day you're born to in our environment. I just firmly don't believe that to my core. I guess the research doesn't necessarily support it, but again, clinically, I've seen AMH increase. I've seen people told that they needed egg donors, conceive naturally a very healthy baby, not once, but twice. I've just seen too much to believe that it's not possible to improve it. So I firmly am against the stance that you can't improve your egg quality, and I firmly believe that you can. And I also don't think AMH is the end all be all, right? So a lot of people
Yeah.
just link egg quality with AMH. First of all, it's an estimate of ovarian reserve, and it's just an estimate. Like if literally, if you look it up, it says an estimate.
You're in the thick of this as well. I am as well, running these companies. Just curious, how do you tend to your own kind of hormone health, gut health amid kind of the emotional demands and obviously the physical and stress of demands of your work?
Running a business, right, can be a lot. I will state that like I love being a business owner, so for me that actually like fills my cup and like helps rejuvenate me. But yeah, being a fertility practitioner, I do believe it's what I'm meant to do, but it can be draining in the sense of I'm human and I really, really care about my patients.
Yeah.
Very much so. Like getting emotional thinking about it right now. That's how much I care about it all. But I think, and I actually just posted about this, was limiting honestly how many new patients I see a week has been great for my sleep, my emotional health, my well-being, because I'm able to give 110% to each patient, which makes me feel really good because I know I'm doing my best. I really stress if I feel like I'm faltering in that. And I was taking a lot of patients at once, and that was definitely in, better for the wallet, but impacting my health. And I was like, you know what? It's not worth it. Life's too short. I really want to be happy and enjoy what I'm doing and give my patients the best version of me. So honestly, making sure that I balanced out the time that I was spending on the clients or patients and how many I was taking a week was a game changer. And now I have so much time to also take care of myself in the best way possible, leading to better results and better care.
I would just encourage anyone who's listening, if you haven't already, find a practice like Dr. Samantha's. Find a functional physician. Yes, you're probably going to need to invest into it. That's how this works. But there is no better investment than your health. And even if it's just for an initial assessment and testing, that's better than not doing it. And it will certainly put you on the right path. So, Dr. Samantha, thank you so much for your time. I want to make sure that anyone who's listening knows where to find you, and just if you want to share more about your practice, how it works. Common questions would be if you see patients from anywhere in the country or anywhere in the world, if you can just talk a little bit more about Walk the Natural Path.
Yeah. So honestly, on any platform, you can find me under Walk the Natural Path. I would say I'm probably most active on Instagram, but I do have a website, right? That's just walkthenaturalpath.com. I have a lot of YouTube videos that do talk about things that can impact fertility. So anything from PCOS, endometriosis, gut health, how PCOS and gut health are actually linked. All of that good stuff is there on the YouTube. And I do have free consultations. I do also have like a jump the line where you can kind of pay to like speak to me a little bit sooner to see if we are going to be a good fit. I do believe you need to find an expert, but you also need to make sure you jive with the person. I think that's really important for good care. So I always love to talk to patients beforehand. Like I said, I do have long visits, and my visits and care is very much personalized, but I want you to know it's not just about like the work that I do, it's also about the work you do. So I like to just mentally prepare people for, you're going to have to be consistent with the plan. I'm going to be there to support you, be creative with ideas. I don't just ever give you something and say, okay, go do it. If you're not successful, sorry. I'm here to be your cheerleader and someone that can actually help you achieve your goals. So I like to say my creativity came through creating treatment plans. That is how I'm creative in this world. I have no artistic bone in my body, but somehow I can get really creative with helping your current lifestyle fit into more of a healthy lifestyle. And then I can see people throughout. I'm not just confined to Arizona. With that being said, patients are in Arizona, so I can do things a little bit different for those in Arizona. You're more of a client if you're in other places, and I am limited with some things I can do, but again, I can answer all those questions for you.
Well, thank you so much, Dr. Samantha. This has been wonderful, and I can't wait to share this information with all of our community. So thank you so much, and we'll see you soon. Hey everyone, thank you so much for tuning in to the Gut Check podcast. If you enjoyed this episode, leave us a comment below. Let us know what you think, like the episode, and share it with friends and family who may also benefit from learning about these important and educational health and wellness topics. You can find the Gut Check podcast on YouTube, also on Spotify, Instagram, and TikTok. The Gut Check podcast is brought to you by our team at Daily Nori. Daily Nori makes probiotic and prebiotic solutions accessible to all because good health starts with gut health. To learn more about Daily Nori, please go to www.dailynori.com. Thank you.